Welcome to the Social Work Rants podcast, providing a platform for social workers to share their stories. The podcast covers a wide range of topics, including mental health, social justice, policy, and the day-to-day realities of the profession. This season, season 9, we'll be focusing on the mental and emotional aspects of money for people of color. Hope you enjoy. Hello, social workers, mental health professionals, and change agents. Welcome to another episode of the Social Work Rants podcast. I'm your host, Bash Moreno. Saludos a todos. Greetings, everybody. Thank you for tuning in, tapping in wherever you are watching or listening to this podcast. I appreciate all the love and support. Gracias a todos por su apoyo. Continue to follow the podcast along social media outlets on Instagram at the Social Work Rants podcast. That is all one word. On X, Twitter, whatever Elon calls it this week, at Social Work Rants, and of course Facebook, aka Meta, the Social Work Rants podcast. Hit that like button. The YouTube channel, the Social Work Rants podcast. Hit that red subscribe button, and of course, however you listen to the podcast, download, share episodes, however you listen to podcasts. So I spent a lot of time talking about networking. And recently went to a wellness get your bag summit. We had a great time. Past podcast guests Victoria Jen Rodriguez hosted, and I met talented Dr. Eveyln Ashiofu. Did I get the last name right?
Got it, close. Yeah. But I will take it.
People jack up my name all the time, so I apologize.
Oh no, you're fine. I get it. No, that was good. That was good. Yes.
So and this episode is dedicated to the almost 75% of women who listen to the podcast. Obviously, social work is female dominated, so we're going to talk a lot of things. And men, there will be men to take some notes, especially if you're married or you're about to have a kid or something like that. We'll have issues that you can look out for to take care of the ladies in your life. So can I call you Dr. Eveyln?
Of course, yes.
Dr. Eveyln, how are you doing today?
I'm good. I'm doing great. It's a little gloomy in New York right now, but we're making it work.
So some, especially some of my listeners in New York, will probably blame the mayor for that, or the governor, or both.
Right, exactly. Combination.
How are things going?
Things are going well. I can't complain. Work has been busy, but definitely good, definitely fun. And, just gearing up for the holidays, which is, like a very important time for many people. And so just gearing up, I know that that's going to bring in a rush of people, but looking forward to it, really.
Yeah, I was just in New York and did the drive by with the tree, take a quick picture and get out of there, and going by all the tourist spot. I love New York during the holidays. It's very beautiful. Like it was so many people. I could tell the living in the suburbs and rural definitely definitely got to me. I was like, what's up with all these freaking people?
Definitely. It could be so overstimulating.
and weren't y'all complaining about the economy a month ago? Why are you all here?
That's outside the holidays. That's outside. The holidays, we have money to spend.
Yeah, so for those who don't know who you are, just give the viewers and listeners a little bit about yourself.
Absolutely. So my name is Eveyln Ashiofu. I'm also better known as Dr. Ev. I am a double board certified adult and child psychiatrist. And I also have a specialty in women's reproductive mental health. Currently, I work in one of the busiest hospitals in New York as an assistant professor of clinical medicine and psychiatry at NYU. But I also do a lot of work working with women adults in Harlem Community Clinic, doing like psychiatric evaluations, diagnosis, and treatment. So that's sort of like my professional career, things that make accompany that. I also enjoy speaking. I enjoy doing things like this. I love spreading knowledge about mental health, mental illness, and well-being. I like providing like psychoeducation around these topics, and just spreading the knowledge and decreasing stigma about these things. And I find that a lot of people are either like unaware or don't really know about sort of mental illness or psychiatric illness in general. And or if they do know, there's a lot of stigma that could be attached to it. And
Mm.
I truly enjoy getting the chance to like doing this, like being on your podcast and just speaking on my career experience, my personal experience, and just spreading knowledge.
I like that. So what are you seeing in terms of adults and kids in terms of their mental health or I know the holidays are coming up, so there's a lot of seasonal affective disorder happening currently, but also like a lot of grief and loss. People like maybe first holidays without certain loved ones, and just a lot happening that happens towards the holidays. What are you currently seeing?
Definitely. So the holiday time has always historically been a very difficult time period for the reasons that you just mentioned. A lot of people have lost loved ones, have had some sort of disruption in attachment, if it's a child, or in relationships, if it's an adult. It could also be just the first holiday season spending without that loved one or that family member. And then there's also just in general, like in the holiday times, it's going to be a lot more stressful. We were just joking about the economy and spending money. And, at the same time, there's a lot of people who are going through a lot of financial struggles and stress. And so the holiday time can serve as a reminder of those stressors that people are experiencing. And so I think in general, during this time, there's a lot more increased levels of anxiety. People are having more mood swings, whether it be more kind of irritability, feeling on edge, or also just feeling sad. Um,
Mm.
and also, and kind of maybe dipping into a more depression sort of picture as well. And there could be a lot of loneliness associated with that as well. And so I have been seeing now as um, oh, and I should also mention with specifically children that the holiday time serves as a time where they're not in school. And
Mm.
you might think like, of course, children should be happy if they're not in school, but for a lot of kids, school serves as an escape from home and whatever may be going on at home. And so we do see that there's some increased levels of both anxiety and depression around this time for both adults and kids.
Right, especially for kids, schools like their safe space, schools where they get at least two meals out the day, and
Exactly.
people are really struggling. Some might be struggling more now than before pandemic, and the pandemic just made things even worse, and people haven't fully recovered from it. So yeah, I could definitely see how uh, kids are struggling. I mean, I see families where I work at now, struggling to pay their light bill, trying to find housing and being kicked out, and like all these eviction moratoriums have ended, with the COVID emergency ending. So landlords trying to get their money, or just telling people to kicking people out, and have legal right to actually do so. So it's a lot that's happening that is not being talked about in the news. It's not being politicians not talking about it. So it's a
Right.
lot that's happening day in day out.
Absolutely. I think it kind of goes under the radar that how these things, these like what we like social determinants of health, right?
Mm.
How these determinants can really impact not only mental health, but even physically as well. I mean, it really impacts so many different facets of life. And it's not being adequately addressed. And so we're definitely seeing sort of the consequences of not addressing these really important factors.
No, absolutely. That what's like a day in, day out like kind of day look like for you?
To be honest, it changes like from day to day. I like to say, I don't know if anybody ever watched like Everybody Hates Chris, but how
Yes.
so how the wife would always be like, my man has 3 jobs or 4 jobs or whatever. I feel like that is me. I have a variety of different places that I am working at or employed at, but it's great because it just gives me such different experiences and it keeps me on my toes. Um, I would say a typical day for me, really, or like starting off in the week, I would start in the emergency room. So I work in a pediatric psychiatric emergency room.
Mm,
And so, as you can imagine, it's very busy. We are kind of constantly seeing children coming in that are needing psychiatric evaluations for a variety of different reasons. Typically, I would say most of the time it's due to maybe thoughts like unsafe thoughts, acute mental health ailments. ADHD is a big one. So, like hyperactivity and impulsivity related to ADHD. Depression is also a big one, which is usually related to like thoughts of not wanting to be alive or thoughts of wanting to end their life. And so I spend a lot of my time there kind of making very quick diagnostic assessments and making the decision whether or not a child is either safe to be discharged home and connected to outpatient care or could follow up with their outpatient therapist or psychiatrist, or if I feel that the child may be too acute and too much of a safety risk to be discharged home and needs to stay in the hospital. And so it's a very fulfilling job that can also, as you can imagine, be emotionally taxing as well.
hmm
Oh,
Yeah, that, I mean, I work with with kind of families now, but definitely worked in foster care, so I definitely saw a lot of those psychotic breakdowns, and even as young as 5, and different different things through the spectrum of mental health, and we mentioned social determinants of health, and it's definitely a lot like the taxing on the mind and the body, definitely.
yes, yes, it is tough. And I mean, granted, like what the kids, like you mentioned foster care and one of our big referral sources is ACS or the like Child Protective Services. And so I see a lot of those children and it what they're going through is also so difficult. And so um but yeah, and there's a lot of like multifactorial things in play that by the time a child is coming to be like emergently evaluated for
Mm,
psychiatric concerns, like there's so many different things.
right.
Yeah.
So what drew so when we met at the event, what drew me to you, what was the conversations about women, premenopause that's happening, the obviously we're the what's up with postpartum depression that's happened, and that I've been seeing a lot because working at a children's hospital, do see a lot of newborns, um, and just having those type of conversations. And this is where us men come in the picture, men who's watching or
Yes.
listening. That I know for me, I was like, what? I needed a Dr. Eveyln my first marriage because I was going to grad school. So you would think being in the social work space and going to grad school, you would pick up signs of possible postpartum, and I missed like all the signs to the point where, like, luckily, like my wife, God rest her soul, she was like, my ex-wife Erica, she was like, I think I'm going through postpartum depression. So she knew what she was feeling and then told me about it. But when you're in grad school, especially at the time, like you barely home, you focus, especially during an internship and working full time. Like I totally missed all these signs, and so she said something and kind of like try to help or as best as I could. And you when you're dealing with a loved one, sometimes you do feel helpless and not really have like the tools you need to really try to help. So, what are some signs or typical signs in terms of postpartum that you've seen? And I know every woman is different, but like kind of like the generalized symptoms you see.
Right, right. And just to mention, before I get into that, my second job of multiple is the where I get to work with adults and a lot of women, and so get to really help them with their mental health challenges in different phases of their lives too. And so that's where this conversation came up, and you're right. I think a lot of people, even the women themselves, if I'm being transparent and honest, miss the signs and symptoms of postpartum depression for a variety of reasons. I think one, society sort of makes it difficult for women to express when they're struggling. It's not, right after you have a baby, typically it's supposed to be a very bright time, a joyful time, a happy time. And so there can be a lot of guilt in expressing that it's not, that it's not a happy time, that I am struggling, that I am having difficulty adjusting to this new life. And so it makes it hard for women to speak about what's going on. And then it's tough on the partner too. It's tough on the men also who are also transitioning to a new role as a father, with having a new child, with having to support their partner. And so some signs that I think or that I feel are pretty typical of noticing if a woman may be experiencing postpartum depression is frequent tearfulness. That's one sign. If your partner is crying sort of uncontrollably, that's out of the ordinary, out of normal for them, that could be a sign that they're experiencing such a significant mood change. That would be something to pay attention to. I'd also say if you witness or observe your partner making sort of guilty statements or self-loathing statements like I'm not a good mother, or I'm not a good person, or this sort of sense of guilt that just seems, it's sort of like, where is this coming from? Why are these statements happening? That could be something that a partner would observe. This one is tough because sleep is by far one of the biggest challenges for new mothers. But if there is if you do notice that your partner is not sleeping as much, even when they're kind of given the time to or the space to, and they still can't sleep, they're up at night, they're thinking about things, that could be a sign that they're starting to dip into a postpartum depression. So that is something to also pay attention to. And I would say one other sign would be sort of isolation, not really wanting to engage with other people, not really wanting to connect with other people. Maybe there's kind of some feeling of distance between you and her, even like with your partner. And even if you observe that it's hard for her to connect to the baby as well. Those are the things that I would be on the lookout for when it comes to making sure we're seeing signs or getting in front of signs of postpartum depression.
It's it's interesting you mentioned sleep. I would think if somebody's sleeping too much, that could be a sign.
It is what we would call like an atypical depression. So in the typical realm of depression, usually it's like insomnia, it's hard to sleep, but definitely if it's too much sleep, that's also a good sign too. So anything that just seems sort of out of the ordinary or out of the realm of normal is something to really pay attention to.
Because I mean, I know for me when I get sad or kind of feel down, like I would feel sleepy more than anything else,
Yeah.
or extra sleepy. I'm like, no, this is not the usual tired or I only slept 5 hours, like, and then working. Like, no, this is something else, and kind of know, like, okay, this mood, like mood issue sleep. So it's funny when she's not sleeping. That just drew my attention. But like I said, everybody's different.
That's true. That's true. And and you bring up a good point because excessive fatigue or low energy, that is a sign of depression. So depression is weird in that you can feel really tired, like your body physically, you feel tired, you feel like you want to sleep, and then you can't sleep. So it's weird. It's like they're two separate issues in that you have this low energy, you have this really crippling fatigue that makes you not want to get out of bed, but then you'll be in bed and still can't actually like go to sleep. And so, but like you said, everyone is so different. It presents really differently. So the key is really noticing the change from someone's baseline. So like once you are aware and they've established like a normalcy for them, if there's fluctuations in that, that can be a good way to tell that something might be going on.
So what can men and women, or especially the women who are going through it, do to get out of that? Maybe funk is not the right word, but to get out of that space so they can start feeling better.
Yeah, so to start with women, I think one thing I'll mention before even getting out of the funk is being prepared for the potential of having a funk, if that makes sense. I
Hmm.
think um, it's important to anticipate that this is a possibility. And to be honest, 1 in 8 women will experience postpartum depression, but 80% of women will experience what's known as the baby blues. So it's not as pervasive and it's not as like persistent as a postpartum depression, but it still can be just as impactful. So the crying spells, the feelings of sadness, the feelings of guilt, it can still really play a role on a woman's mental health. And so I like to say, let's be prepared, the same way that you're showing up for your prenatal appointments and making sure that the baby's healthy. Let's start to get things in play. Let's get a plan together to address some of the most common factors that influence or sort of contribute to the baby blues or contribute to what can become a postpartum depression. And so making sure you have a good meal plan. Um, who's doing the cooking? Do we have family that's around that's going to be bringing food? How is that going to work? Are we doing a meal prep service? Is someone coming in the home and like a family member or someone else to help cook? Like let's get that plan straight away. Let's talk about sleep and how we're going to do that. Do you have a partner who's going to be around that's going to help offload some of the time you're spending with the baby so you can make sure you're getting enough sleep? I think those sort of things, having them already in play and maybe even written down, like there's a very solid plan, can be very helpful because we want to try to mitigate as many of those risk factors as we can. And so preparation is key in my opinion. But let's say we do get to the point where a woman is now experiencing postpartum depression. I think the first step is really acknowledging that that's the case and not being afraid to articulate that you are struggling. Again, like it goes back to what I was saying, there could be a lot of stigma associated with postpartum depression. I think that probably more women experience postpartum depression than we think, but again, it's just like who wants to be the one to
Hmm.
say that they're experiencing that. So, number one, not being afraid to acknowledge that you're having some difficulty. Number two, I would say some of the things that should be addressed, in my opinion, before you deliver should also be addressed during that period. So, however way you can get some physical activity in, it's going to be so key. Moving your body intentionally as much as you're physically able to is going to be very important. Making sure that you have a well-balanced diet is going to be important as well. Some stress reduction strategies are going to be important. So meditation, mindfulness, things to just sort of bring your mind and mentally bring you to a state that's a lot more calmer when it feels like things are very chaotic or out of your control. And so I would say that's one key. The other key would be more kind of intensive interventions, right? So like maybe you need therapy, and not being afraid to accept that therapy, counseling, groups. There's a lot of support groups for mothers who are experiencing postpartum depression. So kind of getting more into intentional interventions at that point could be helpful as well. And then lastly, I would say, as a psychiatrist, I definitely feel that if there comes to a point where the safety of yourself or the safety of your baby is on the line, that medication intervention is always there, and available for women who are struggling with postpartum depression. And so seeking out professional help via a psychiatrist or another provider is key as well. So that's for
Cool. Good.
women.
Anything the male partner can do?
Yes, definitely. I feel like the men, do not be afraid to ask your partner how they're doing, how they're feeling. I think just being observant and understanding what the signs and symptoms of postpartum depression are. So I'm glad that that was how we led on with this conversation, but being able to observe that and asking very frequently how your partner is doing. And because sometimes it's as little as giving her the space to say that, she's not doing well. And then when you do get that feedback, or if you are noticing that there's signs that are occurring that seem consistent with a postpartum depression, encouraging your partner to seek out help. Making it sort of like normalizing the idea of seeking out help for depression is also important. Like they need that they need that encouragement from their partner to let them know, like, it's okay, and that I'm here and I support you. So I would say those two things are important. And then also kind of where you can take the brunt of those risk factors that we discussed earlier, do so. So helping out with any work with the baby, giving her the chance to sleep. If you can cook or provide that, those things that can be more difficult or tougher for the women to tend to during the period, doing that. So offloading as much of those responsibilities, offloading that from her onto you could be very helpful.
That's definitely good tips for both men and women. I appreciate that.
Yeah.
Now, I'll talk about the premenopause for a second. I first heard the term a, a while ago, but I was like, "What is that?" Because I heard of menopause, and even menopause kind of gets, you know, joked around, but it's an actual, condition. Women get very uncomfortable with it, and it could affect even relationships. But premenopause, so I had to Google it. I was like, oh snap, and it's like kind of almost like a double a double whammy. Like you get it before, then you get the full blown, and it's like so
Right.
so how is it more common than even like women willing to admit? Cause I hear more and more women talk about it, but is it being like more uh socially acceptable to talk about it now, or just kind of people just talking about like what are you seeing?
Yeah, I think definitely that we're seeing people talk about it more than they used to. I think it's something that obviously probably always existed. And again, I think it's associated with societal norms and societal expectations and stigma associated with that period, because it's essentially the period about 12 months before entering into full-blown menopause. And so at some point we may have just like clumped everything together, but now we're recognizing that no, this perimenopause period is its own discrete period where you're starting to go through that transition. You start to have the hormonal changes. You start to have sort of the physical manifestations of what is to come, but you're not quite in menopause yet. And so it's just it seems like it's just weird period in a woman's life that doesn't quite you can't quite relate to before perimenopause, and you can't quite relate to when you're in menopause. And so I think now that we're starting to recognize that it's its own discrete transitional period, more people are coming out and speaking about sort of what you can expect, or what are the different changes and experiences that women are going through during that time.
What are some of the signs of premenopause for people who may not know what that is, or maybe this is the first time I'm hearing that terminology?
Absolutely. So, perimenopause, like I mentioned, is the transitional period before you get into menopause, and it's really characterized by hormonal changes. And so, dropping levels in estrogen and dropping levels in progesterone, which are like considered like the female hormones, if you will. And so a lot of the manifestations that we see during perimenopause are associated with that. They're associated with those changes. And so physically, you could expect to see hot flashes, more vaginal dryness. You can expect to see some sleep changes, like more insomnia and difficulty sleeping. You can experience what's known as brain fog, and that's actually a pretty popular experience that women have during this time, which is like just difficulty concentrating, some trouble with memory, and like just not being able to recall things as easily or as quickly as they used to. So those are some of the physical manifestations we see. But we also see there's pretty significant mental health manifestations as well. And so women
Mm.
during menopause, they tend to experience increased levels of anxiety, increased levels of depression. There may be some more increased levels of irritability and just feeling sort of easily triggered or angered by something. And that one is explained by the hormone changes, like I mentioned earlier. But then also you have to recognize that perimenopause, that time period in a woman's life can be an emotional one in general. It signifies a change, maybe the change in aging, like a woman's getting older. That time period is usually also associated with maybe children leaving the home, maybe now having to take care of parents. We were speaking about this earlier. So it's a time period in a woman's life that can signify a lot of different things, and so can also contribute to the mental health challenges we see during that time.
Okay. Very, very interesting. Now, is there uh how early have you seen like women like start the premenopause? I know everybody's different.
Right. Everybody's different. I think the earliest that I've personally seen has been like late 30s, like maybe 39. It usually starts around 40s. Um, but I mean, there's women who have started to experience it even as early as like late 20s, which that's probably
Mm.
the earliest, but it's possible. But I would say on average, you usually start to see these changes around 40s.
You mentioned brain fog, and the first thing I thought of was COVID, and I know like people still experience a long COVID, and like people haven't fully like recovered, and it's like so what if like a female had COVID, had to deal with brain fog, and now like did they fully recover, and or is it like premenopause? Like how could how could you like check to make sure what exactly it is?
Right. No, that's a good question. That's a good question. I think that could be tougher to tease out. I think if there is a change in the level of brain fog, so maybe at one, they were experiencing brain fog, but at least they were still able to kind of get through the day. They were still able to function at work. And then now they're entering perimenopause, and now that's become significantly more difficult than it used to be. Like even completing an assignment or completing a task becomes very, very tough. And so I would sort of try to see the change, like, okay, like you had this issue of concentrating and memory, you had that issue before, but are we seeing something different? Are we seeing that it's more severe? Are we seeing that it's like maybe lasting longer? That would be the way I would try to tease out if this is strictly like due to COVID versus perimenopause.
Gotcha. And I know a lot of us social workers, and I'm sure doctors and nurses and teachers as well, uh, we tired.
Yep.
We just went through a whole pandemic. There's like shortages everywhere, and people just struggling, as we mentioned, earlier, and now you know people are some people were already struggling, and pandemic came and made things worse, and some people haven't fully recovered, like I mentioned earlier, and it's like we still dealing with the aftermath of what COVID looks like. And you mentioned from a psychiatric perspective, just overall social determinants of health, and people have lost loved ones. I lost a loved one. I lost clients from COVID, and like kind of like just life and went through 4 going on 5 years in a blur, and it's like it really was a blur and kind of not really been talked about.
Yeah. It's so interesting because I that's something that I talk about with my colleagues a lot about the number that COVID and the pandemic really did on us as a people, how it's impacted us not only physically but especially mentally. Things have changed so much um, since the pandemic, and it's very clear. There's so much research that has shown very clearly that mental health challenges, mental health illness has increased in numbers, and also the risk has increased since following the pandemic. And there's the kind of like direct correlation, meaning like people who caught COVID and then got sick, and then there's like the mental health sequelae because they got sick from COVID. But it's also kind of what COVID did to us as a society that's also impacting our mental health. And so just the fact that we were isolating for so long, and so a lot of, especially this applies to kids, but even adults too, who are
Mm-hmm.
so used to isolating, and now you're telling people to go back in the office, go back to school, go back to work, and they've developed this sort of anxiety around being around different people. There's more loneliness and isolation. The idea of like interactions outside of the home are lower. And there's a lot of research and literature that shows that people just in general feel more lonely than they had before. They feel like they're not interacting as much as they have before. And these sort of things, this kind of lack of social connection, the financial constraints as well that the
Mm-hmm.
pandemic has brought on for a lot of families. These are those social determinants of mental health that we see following the pandemic that are still like having such an impact even today, even as we're nearing the 5-year mark.
Yeah, I was coughing earlier, and even still to this day, I will see somebody coughing or sneezing, and like turn my
Yeah.
head real quick.
Exactly. It's still like up till today. It's still a thing. It's
Mm-hmm.
still a thing. So, and I think the craziest part about it is that we still won't really know the impact, like how huge the impact of the pandemic will be. We still won't know. It's something that is going to take years and years and years of more data collection and research before we really have an idea of like, what did this do to us? Like, what did this do to us as a society?
No, we look at, I mentioned the politicians earlier, but we look at them to make policy changes or corrections, or just in general, just making the laws. But if they're not even like talking about what we talking about, like how, like they're not seeing the people, like the day to
Right.
day. day-to-day stuff, like, okay, you just want my votes, but you're not really addressing the actual day-to-day needs so you can make proper policy changes that need to be really made that can really like affect us in a positive way, day-to-day stuff. If you're not even talking about it, like,
Right.
we went through, I worked at a school like for a year and a half, and it's like schools went back to the status quo, like COVID never happened. They put a piece of paper, kids were flipping chairs and tables, seeing a piece of paper on the desk. So it's like, what is this? I've been on Zoom for the past year, or iPad like a year and a half, or never did preschool or anything. And I'm like, what are you showing me a piece of paper for? What is this?
Exactly, exactly. It's I mean, as much as the pandemic was unprecedented, obviously no one could expect that something like that was going to happen. I think not acting quick enough in addressing those things is to many people's detriment, to children's detriment, to adults' detriment, like not being quick enough in responding and making sure that there's infrastructure in place to like make a seamless transition out of what was so different and out of the ordinary for all of us. You know, I don't think that things have been adequately addressed, and they still haven't been adequately addressed, unfortunately. And so we're still going to continue to see the repercussions of the pandemic, both physically and mentally. And so it's unfortunate, you know, it's unfortunate. And I think it's easier for people to kind of like act like it didn't happen, but I can or act like it's over. But I can say from my own experience and seeing people coming through the ER every day, or seeing people in my outpatient clinic, is that it's definitely happened. There's definitely a lot of trauma that's associated with
Mhm.
the pandemic, and we're still seeing the repercussions of that.
No, absolutely. And we're not even talking, we could talk about the federal, from the federal level, but it's like local level, just nobody has addressed anything. Like the Department of Education did not address this at all. Like from a federal perspective, I mean, and it's from both parties, so it's like that hasn't been addressed. Like nothing on the medical side, nothing has happened. Like this, you know, it's just been like, okay, COVID happened, and that's what we moved on. Like, and it's not even talked about, even though people get it from time to time. It's not like it was when it first happened, but um, it's just madness right now.
Yeah, yeah, that's that's really the best way to describe it at this point. It's just, yeah, I think it's easier to just like, all right, let's move on. Like that was, you know, like that was awkward. Let's keep it moving now. And it's like, no, this is something major, you know, that it deserves the time and attention. Um, and yeah, just it hasn't happened, I think, in the way that it should have at all.
Right, and it just gonna make, you know, the health system even more stressed than it was during pandemic. Like you're going to see more and more hospitalizations. We'll see more and more outpatient visits. You know, talking about who knows what I call Agent Orange, what he's going to do with his policies, and just trying to cut ACA, trying to cut all these different things, and it's just going to lead to more hospitalizations and more early retirements from doctors and nurses, and going to be more short staff and just longer waits in the ER. It's just the domino effect is just gonna, in a negative way, is gonna continue.
Yeah, no, for sure. I mean, the healthcare system is very stretched. I think there's a lot of pressure, and I mean, stretched as in the people who are kind of like on the ground,
Mm,
providing all of everything, providing the care. They're stretched really thin. There's a lot of pressure on the systems right now, and so any any program or any policy that's going to cut any sort of resource or service that's that's aiming to kind of make that easier, it's really just going to make things worse. And so I am kind of afraid of what is to come. as far as in healthcare and even in education. I'm hearing the talks around education as well. And we know that health and education is intimately associated. And yeah, it's scary to think about what's to come.
Yeah, it's a lot of unknown, which
Yeah.
leads to even more anxiety because the anxiety is definitely like increased, since pandemic, and it's a lot of depression that's happening. And mentioning, even if you didn't lose anybody, lucky enough not to lose anybody, but just going through a whole pandemic is enough vicarious trauma. It is alone, and along with just being isolated, not able to see anybody, or just doing a lot of Zoom calls, or just FaceTime or whatever. Like, luckily, there's more technology now that you can kind of get by, and there's more and more stuff every day. But still, like that physical connection, like you know, meeting you in person, and doing that wellness summit that we went to, that those things were definitely like missed, and that stuff still is needed. But at the same time, like everybody, we all got a got a story from the COVID years.
Absolutely. Yes. Yes, absolutely. Like that, I think the physical connection, and that sense of community, because you can, be on Zoom and be on all of like social media and stuff, but it doesn't translate the same as like physically being in community, physically being in the presence of someone. And the more you do not do that. So the more you're like just chronically online and not getting to experience people in person, the more anxiety provoking it becomes when you are faced with having to do that, which is why I think anxiety really shot up for children once they had to go back to school, because it's like we're not used to being in front of people, and I don't know what you're going to say and I don't know what to say, and now I'm really anxious about just talking to you, just looking at someone in person, because I haven't done that for almost 2 years.
Mm.
um, and when you feel that anxiety, then that's when a depression can come along, because you don't want to have to do that. You're forced to do something that you don't feel comfortable with. And so you start to feel saddened by it. And so I think the physical connection and sense of community that's like offline, I think it's irreplaceable, honestly. And I think if we don't do things, or if we don't try to help foster that for and when I say this is both for kids and adults, because there are several adults that I have worked with that have had the same sort of sentiment. Like, I don't like being around people. Being around people makes me anxious. I feel really sad or really angry that I'm having to go back to work, or I'm having to take the train or take the bus, and it gives me a lot of anxiety. And so not fostering that ability to have a sense of community, I think we're going to see a lot more of, that sort of sentiment.
Yeah, I mean, even if like a hybrid schedule, and they try to add like an extra day, like say you work maybe like 3 days at home, and now they're trying to take out that extra day, have you go back to the office, he's gonna complain about it. So,
Right. Yeah.
and
Yeah.
we went from like full 5 days, and now COVID happened, we work from home, and now I had a day, and now they had 2 days, or like, so even stuff like that, like is those things that we didn't think about, like in up to like November, December 2019, when we first started
Exactly.
hearing those rumblings and those first cases of COVID in America happening. So it's like I said, a lot has changed in these last four going on 5 years now, and it's like is even for me, like it like a year ago was like the first time I took the New York City subway since COVID. Obviously, I moved. I don't live in New York anymore, so like I do a lot of driving now. So um, it was like weird. Like it was only like a 10-minute train ride. I was like shit. I gotta get on the subway. Wear my mask. I know I brought a mask with me.
Yeah, Yeah, no, that I would feel the same way. I would feel the same way. Like in the at the peak of COVID, I was living in Texas, and so coming to New York, like in 2021, and seeing like obviously New York got a big brunt of COVID. It was
Mm,
horrible here, but and seeing that, oh, you're on the train, you're with thousands and thousands of people at any point in time. It makes it kind of like,
mm.
ooh, like that's a lot of worry there. Like fear is just around a lot of people.
Yeah, I was like, I got to refill my Metro card, and I got to touch these machines with no gloves. I didn't bring my glove.
Exactly.
Where's my hand sanitizer?
Right. Let me like pull out a wipe. I got my little hand wipes and
Pull my sleeve over my hand and like, use my sleeve. Like, and some of the stuff I still do, like even like when I pump my gas, like I pull my sleeves or I make sure I get like a piece of paper or something, and I touch the pumps, and so it was like it became like low key germaphobe from COVID. So it was like
No, same. I feel like a lot of people are like a lot more clean and germ averse than they used to be.
yeah, because I remember like I still had to go to the office those first few weeks in March 2020, and it's like I touched the door, accidentally touched the door, and I like run to go wash my hands. Like anything I touched, darn it, I touched it. We go wash our hands. What about the hand sanitizer? So it's like it's funny now, but it's like back then you just didn't know, like we were getting stuff from like working at a outpatient medical company, like long term care, and it's like we're going by CDC directives, and it's like they try to figure out themselves what what's happening. So
Exactly.
it's like we didn't know what it was, and we literally having clients getting emails from clients passing away. And it's like we don't know what's out there, what's happening, and and we still got to take subway or
Right.
taking a bus to go to work. I mean, I stopped taking buses altogether.
Really?
Yeah, actually, I took the bus, the New York City bus, this past weekend as a disc recorded for the first time since 2020.
Wow.
Yeah, it was,
Wow.
and I didn't feel weird about it. It's just New York. The New Yorker in me is just all right. Like I didn't have a mask on either. Just riding the bus and just kind of seeing how much things have changed where I was at. I'm like, they put this now. They put a Target here now. It's crazy. Like what's
Oh
so,
my goodness. Yeah.
so yeah. So it's like I still got family I haven't seen since COVID because they live in New York. It's just I live out of state, and it's like I go to New York for business or like any social work stuff. Like most of my social work peers are in New York, and it's like, all right, there's an event, I'll go, and it's like usually happens on a Friday night, Saturday, whatever, and do a quick 24-hour, maybe 48 hours, and that's it. Out. I,
Wow.
I be I be I'll be dying to get out of New York.
Well, did you leave because of COVID or for a combination of
There's a combination of not really COVID. Like it's funny because we went to 2019. 2019 was like, okay, 2020, we're gonna move.
mm,
And then COVID happened. It was like, are we gonna move? What are we gonna do? And it's like, luckily my in-laws now, uh, my brother-in-law is like, just come live with us until you figure it out. And so like, because I was coming to Delaware like from like 2018, 2019, for the holidays, visit family and stuff like that, and kind of like driving me around and like seeing all this new construction, like literally new communities they building from scratch, like from the ground up, and it was like, oh damn, this is nice. They coming back home as like you see this. And there's no shade, but you still like see the same people on the block doing the same thing every day, and it's like, and then going to work, and then you see like politicians doing dumb stuff that's not making the city better, and it's like I'm ready for a move. Like
yeah.
it's time for a change. Let me try this. try this Delaware thing out.
No, good for you. Yeah,
Yeah.
change of environment.
New York, going to New York is actually stressful for me. It's like it's a lot of. I get very anxious going back home. It's like, do I drive in? Where's the event going to be at? Do I take Amtrak? Do I drive into Jersey to take New Jersey Transit train to go to the city? Like, find a hotel. Like, why is the hotel prices so damn high? Like,
So high, so high.
do I get a hotel in Jersey and then drive in, or if not, like what train and bus do I take to get into New York, or just like it's a lot. It really is a lot to go back home. Like it's just that event we went when we met. I was like, I gotta go because like I've had Victoria on and I've been following her for years, and like I'm ready to make some more money like on my business and stuff like that,
Yes.
and figure things out. So like it was good finally meeting her in person after I've been following her for a while, at least a few years online, and doing some of her training stuff. So it was like, all right, I'm gonna go, and like it was in Washington Heights. So like literally like going across the bridge. I grew up right in the Bronx, right?
Oh,
So
wow.
it's like literally back home.
Right.
And just going up the streets, Washington Heights, and just vibes. And so Washington Heights is a vibe. It's still so it's like just back in surroundings that I've like walked up and down like many times. And it was great and great event and
So
meeting
good.
talented people like yourself, and just kind of we all there to learn something and connect and build and get ready for 2025.
Yep, exactly, exactly. No, it was so great. I'm glad to have met you and so many different people. It's like it's always good to just be around people who have like similar drive or similar goals and similar mindsets. And so it was so fun and fulfilling. Like I left there like, all right, I'm ready to get to the bag.
uh, until she mentioned her initial offering, and everybody went quiet.
Oh,
Heard a pin drop after that.
it was it get a little a little quiet.
All good. So now speaking of 2025, got any goals for the new year?
I do actually. So I mentioned a lot of the jobs that I have, but one of the things I did mention is that I also am growing sort of a mental health platform, and
Mhm.
it's geared towards women professionals. Like obviously, I love working with women, and it's called Girl Choose You, and so that is going to be launching next year, and I'm very excited just to be able to provide more like tailored education and even services and products for my working women who want to make sure they are prioritizing their mental health in the new year. And so that is like my big baby that's coming to fruition next year, and I'm super excited about that.
That's great. Congrats on that.
Thank you. Thank you.
Cool. Where can people find you?
Yes, yes. So I am on almost every social media platform, I'm sure. On Instagram, and YouTube and TikTok. You can find me at what's good underscore Dr. dot EV. So what's good, Dr. Ev.
I I like that handle. I mean, I follow you, so but you saying it out loud, I'm like, yeah, that's her handle. I didn't, it's cool. Her handles, I like it.
Yes, yes. It's like a homage to my Houston Southern roots, and what's good is a nice little greeting, but it can mean multiple different things, and so I love it.
Gotcha. Well, it was great connecting with you, and we'll talk soon.
It was so great. Thank you for having me. I love the conversation. I appreciate you so much.